Hi, my name is Megan Soun, and I am going to be speaking today on containing our emotions through thoughts and actions. So I'm going to be drawing from two different schools of therapy today, cognitive behavioral therapy and then dialectical behavioral therapy, CBT and DBT. So to start with, sort of the basis through which we're going to be understanding emotions is the CBT three-component model. And basically in this model, thoughts, feelings, which refer to our physical sensations around our emotions, and our actions are all intertwined. So for instance, if I feel maybe stressed about something, maybe I notice I feel some tension in my chest, my heart starts beating faster, so those are the feelings. That might lead me to think, oh my gosh, like I'm not sure I'm gonna be able to handle this thing might be too hard. And then the action I might take as a result of that is maybe I go on my phone to sort of numb out my feelings. So all our thoughts, feelings, and actions are intertwined for emotions. And the premise behind this is you can intervene at any place. So if you're trying to work on coping with your emotions, you can intervene at the thought level, the physical sensation level, and the action level. So today we're going to be focusing on intervening at the thought level and then also at the action level. So starting with thoughts, our thoughts can have a really big influence on our emotions, and our emotions can have a big influence on our thoughts. So for example, how we interpret an event, whatever thoughts we have about it will impact our emotions. Let's say we text a friend, they don't respond back, and our thought is, this friend doesn't care about me. That's going to lead to emotions of maybe feeling insecure or sad or frustrated. Similarly, our emotions can affect our thoughts. So let's say we're in an anxious state about work. Then we might be more inclined to see the world through this anxious lens where things start to feel a little bit more overwhelming or scary. So maybe you just start to get more anxious about everything. When you're anxious about work, you get more anxious about your house being unclean, for example. So something you can do towards adjusting thoughts is this process called checking the facts. So start by just what emotions are you noticing? Then I want you to think through what events prompted this emotion. And then I want you to ask, what are my interpretations, thoughts, or assumptions about the event? Next, you're gonna ask, am I assuming a threat? And if so, label that a threat and really assess the probability that that threatening event is going to occur. Then I want you to think about, what's the catastrophe? What catastrophe are you nervous will happen? And I want you to actually picture coping well with that catastrophe. And then the final question is, does my emotion and its intensity fit the facts? If it does fit the facts, I really encourage you to go through different mindfulness or acceptance strategies. And then next, we're going to talk about action. So every emotion has some sort of action urge. So for example, if you're feeling afraid, your action urge might be to run away or to avoid a situation. So one of the ways we can change our emotions is by acting opposite to the action urge. So for this process called opposite action from DBT, you're going to name your emotion, check the facts to see if your emotion's justified. If not, then you'll identify and describe your action urges. Think through, is acting on this emotion effective in this situation? Then you're going to identify opposite actions to your action urges. So maybe if you're feeling afraid, you want to avoid, the opposite action is then to approach and not avoid. Okay, thank you so much. Hope this was helpful.